think we're here today to try and inform as many veterans as we can. We're here with Dr. Bash.
Welcome, Radio Land, TV Land, and YouTube viewers and listeners. This is Dr. Craig Bash. I've been doing veterans medical opinions for 30 years, and I have dozens and dozens of these radio shows which we're going to publish on this YouTube channel, and number 1 through whatever. So thank you for listening, and here we go.
VA could have said, no, we can figure that out. Our doctors are so smart. They know what the features of personality disorder are, and they know what PTSD is, and they know how they're different. And so our doctors can tell how much of it's due to personality and how much is due to an acquired disorder. Nonsense. VA didn't do that. VA said, you're right. And they said, we don't do that. We do not deduct a degree of disability for a coexisting condition if we're not able to distinguish the difference. And they said, our rules require us to grant the benefit of the doubt to the veteran so that all signs and symptoms will be attributed to the service-connected condition. You know, people in the business don't often take the time to actually read the Federal Register when VA proposes a rule change, so you understand and get some insight into why they're making the change. Get some insight into what the thought process was and why they came down one way or the other. Now, at that point, VA could have chosen to disagree with DAV and say, no, we know how to apportion the disability, but they did not do that. They said, no, we give benefit of the doubt to the veteran and attribute all signs and symptoms of mental illness to the service-connected disability. Got to tell you, I have encountered people throughout the system who never heard of this court precedent, never applied the Eggshell skull rule, and even some of the people in central office who are responsible for oversight for the compensation service would argue with me about what I just said because they still believe they can.
You know. Now, Bill, wouldn't this kind of fall into the similar category as reduction of benefits?
It can
Some
happen.
of these same rules, couldn't they apply?
It can happen, and I've seen it. Of the VA review process, if we are giving a veteran an exam, and the result is we're going to increase, no problem. But if we're going to decrease, then the examination report must tell us how do we know it is improved. And when I say improved, I don't mean just the elbow bends further today than it used to. So now it's only 10% disabling instead of 20. Okay? I mean that VA and the examiners explained and VA recognizes exactly how and why we can tell that there not only was there improvement, but it is a material improvement. In other words, not just a little bit, but a material degree. Secondly, that this represents the degree of disability that is sustained. So first we have to show the improvement is material. Then we have to show that the material improvement is sustained, which means it's not just a good day. It means it represents the chronic level of disability at this time. Now, after we've decided that there is improvement, that it's material improvement, and that it's sustained improvement, now we have to show that it was achieved under the ordinary circumstances of daily life, including employment. In other words, the intent is we're not going to reduce a veteran who, for the last 2 years since his last exam, has been at bed rest. Okay? Well, that's not how we evaluate disabilities. We evaluate, for example, the mailman delivers mail. We are to evaluate his knee at the end of the workday, under the ordinary circumstances of daily life, including employment. That's where this system most often breaks down, because with VA's electronic rating system, it's called Veterans Benefits Management System -rating, VBMS-R. That's the computer program. And it has a calculator built into it. So you choose a diagnostic code, you put that disability in, and it will prompt you to enter into the program. So if it bends, let's say the shoulder abducts halfway, 45 degrees, okay? That's one disability. But we have to show that that's sustained under the ordinary circumstances of daily living. So we want to examine him after he's been at work all day. Maybe he's delivered furniture. Okay? That would have a huge impact. So we have to make certain that it's not a result of rest. And it's not just a temporary remission, but it represents the chronic level of disablement. That's where the system examiners aren't prompted to. The DBQ doesn't ask. Raters, remember, they got to get a lot of cases done every day, don't take the time to conduct the analysis. They simply transpose the data from the DBQ into the computer and typically accept what the computer tells them the evaluation should be. That's the weakest point. And if we rebut those simplistic exams with more comprehensive evidence and a better medical explanation, we have a chance of reversing that proposed reduction.
You know,
yes, sir?
Bill,
Yeah.
I hate to interrupt you here, but
Go ahead.
you brought up a point here I think might be important, where, you know, you was referencing the mailman. If you want to get a true reading of his knees or evaluation of his knees, it should be done at the end of the day after he's walked all day long and he comes hobbling in, you know.
Exactly right. And I
whenever,
remember. Yes, sir?
Yeah, but what I'm getting at here, I have to go down for oxygen certification all the time. And they do that at rest. They don't walk you across the floor. Of course, they're not going to walk me across. I can't walk across the floor. I mean, if I could, they don't walk you across the floor, then come back and take your O2 saturation. They take it at rest.
Yes.
Now,
yes.
are we talking two different situations here, or are we talking the same criteria?
They're very related. They're very related circumstances. And when I was representing veterans as a service officer, I would always have my veteran come in and visit me before the exam. I would make a point of that.
Yes.
I wanted to make sure that we do not give a distorted picture to the examiner. The examiner needs to know what that disability is like under the ordinary circumstances of daily life, meaning active, okay? So if you, for example, back to the knees, if you're being scheduled for a VA knee exam and you sleep all night, you get up in the morning, you drive a ride over to the medical facility, and you sit down in the waiting room for an hour or so,
Yes.
you are distorting that disability picture because
Correct.
you're creating
Yeah.
the circumstances where you have limited your activities to the minimum amount, rest and sleep, for the examiner to examine. You owe it to that examiner to be active and stay active prior to the exam so the examiner can see what it's really like.
I
That's
agree.
the intent.
Yeah.
So I'd tell a guy, mow the grass the day before you go.
Yeah.
Let us see what it's really like,
Yeah, they want to evaluate you at your best possible condition instead of evaluating at what it actually is after you've been out working or
Yes,
put stress on all your joints or whatever.
We are so often shoved into that conundrum, into that trap. Because we're not aware, okay? Hopefully some people will hear now, and they will understand you need to be up and active, what your life is usually like, so that the examiner will be able to see what it's like when you're active. Now, if you've seen DBQs on joints, you'll notice that there are a couple of, one is the initial range of motion. How far does it bend when the doctor measures it? The next one is, how far does it bend after repetitive motion tests? And then the third one is, what's it like on use and during flare-ups? That's the one that we're supposed to use for the evaluation if it's worse. Now, the breakdown in the system is that the examiners are typically saying, well, I don't know what it's like during a flare-up because he's not having one. Or I don't know what it's like on use because it's not on use at the moment. And so they don't put in a value anything different from the initial range of motion. Now, you might have witnessed what I call the 3 repetition test. Move it 3 times and see if it gets worse. Well, I think any of us who has arthritis realizes that if you move it 3 times, you're not making it worse. You're freeing it up. You're working it loose, are you not? That's my experience. And so I've never been a fan of that free motion test. It was created just after the court's ruling in DeLuca. In DeLuca v. Brown, 8 Vet App 202. That was decided in 1995. And that's when the court didn't create this test. The court said, VA, you have a regulation, okay? And you're required to obey your own regulations. So in a sense, yes, DeLuca was a precedent because the court never had reviewed 38 CFR 4.40. And so there was no lawful precedent. So it's a precedent in that the court for the first time reviewed the regulation and said to VA, you have to obey your own regulation. Well, that regulation was in effect since the 1930s, okay? And the court didn't create the regulation. VA did decades ago. So, but anyhow, the court made it clear in DeLuca that you have to describe pain on use.
Okay.
I believe we have Dr. Bash in here now. Dr. Bash, you here? No, I don't guess he is. Must
Okay.
be. We have a
That's
caller
not Dr.
here.
Bash.
Huh?
That's not Dr. Bash.
Oh.
Okay. Okay, so I just wanted to point this out, that DeLuca said VA have to comply with different regulations. That was in 1995. I had never seen any training modules on this concept until 2010. 15 years later. Was the first time I saw VA actually conducting training on this concept. And in order to comply with it, their resolution was, we're going to bend it 3 times and see how far it moves after we bend it 3 times. Don't think I've ever seen an examination where the examiner said, measured it to be worse after loosening it up. But there was there's been a whole series of decisions on joints and motions. Mitchell v. Shinseki came out in 2011. And it sort of went against veterans somewhat, because you have to be able to quantify the additional loss in degrees, okay, to be objective. But then we had Correa. I call it that because some wrestler had his name spelled that way. V. McDonald in 28th Fed Act in 2016. Now, this was just for a painful joint. The question is, well, the regulations at 4.59 says that you have to test the joint in weight bearing. Okay, so and a few other things as well. So VA amended the DBQ to add those additional questions, weight bearing compared to the other side, things like that. So it's important to cover those bases. Now, if an examiner were to take the time and explain how and why they reach a conclusion that it is additionally restricted under those circumstances, then the rater would be compelled to use it. If, for example, you had your own doctor conduct it and explain to VA why your shoulder can move 80 degrees from your side, but on use and during flare-ups, it only goes halfway, and the doctor can explain how he knows that, and VA would be compelled to use it. So that's how we can use medical evidence to prevent the reductions, because they just go too fast. Now, we haven't touched on severance. Severance is far more difficult. It should be very rare. But I have seen it, and I've seen it done incorrectly. Again, the court's had a whole series of decisions on this topic, and if it is severed without observance of applicable law, then again, it is void ab initio and must be reinstated back to the date it was severed. And like I said, that I can remember that back in back in the 1990s, when that was very clear in the court. And there was a case, Hedgepeth v. Wilkie, just here in 2018, in 30 Bit Act, which goes back and reinforces it again, okay, using the same law that had already been in effect before. Now, what was unique about Hedgepeth, and I want to touch on this because I've seen it before, VA was sort of trying to accomplish a severance without saying so. What they were doing is saying, well, you've got a new diagnosis, and you don't have the symptoms that comport with this degree of disability that we previously gave you. Well, by attempting to apply rules for reduction instead of rules for severance, okay, they were taking the veteran to 0% based on a change in diagnosis rather than demonstrating material improvement in the condition. And so, and I've seen decisions, and I've helped some folks, other raters and what have you, who get confused between the difference between severance and reduction. Or maybe some aren't quite as benevolent as we would hope, and actually are attempting to minimize compensation or eliminate compensation by characterizing it as reduction rather than severance, because it's a more difficult test to achieve severance. Give a real quick example. A rather well-experienced decision review officer came to me one day and asked for me to second sign their decision to sever a disability. Well, once I read what that person had written, I tried to help them understand you cannot do this. And here's why. It was a question of the evaluation of the needs. And the veteran had been assigned an evaluation for limited painful motion for arthritis and a separate evaluation for a torn meniscus, both compensable. Well, VA's manual, M21, said you can't have both. You cannot have an evaluation for a meniscus and any other evaluation of the knee on any other basis. The manual said that. So what the rater was actually doing was saying they were going to sever service connection for the meniscus and rate for the evaluation instability because that gave a higher overall evaluation. No, can't do it. You can't do it. For this reason. The rating that granted those separate evaluations was entered before VA put that additional restriction in the manual. So you cannot say, okay, we're going to sever this because it's clear and unmistakable error to grant it because the manual says so today. If you're going to attempt that, you have to demonstrate that the grant, when it was made, was clear and unmistakable error based on the rules at the time of the grant, not subsequent changes. Okay? So that didn't happen. Now, of course, since then, the court overruled the manual. VA, see, that's another danger. VA puts things in the manual instead of publishing it in the Federal Register, and so you don't really get this opportunity for notice and comment as you would if they were properly complying with the Administrative Procedures Act. So now the court is reviewing manual changes because VA is using them as substantive rules and deciding whether that rule change should be permitted. And in the case of this meniscus disability, the court reversed VA's policy and informed VA that, yes, you can have separate disabilities, but you cannot, you have to conduct the analysis and determine whether or not you would have overlying symptoms. So what I mean is, if the meniscus is causing instability, it would be improper to give the veteran two ratings for instability, one for instability and one for the meniscus that's causing the instability. That would be pyramiding. But that's not what the rating schedule necessarily searches for when it comes to evaluating meniscus. It's swelling information, okay? Not necessarily instability. So I checked. I haven't seen that VA take any action to correct that. We'll wait and see. I think they'll probably be correcting that in the near future. Now, since I brought it up, the guidance for severance, I mentioned it briefly, but I want to stress it. VA cannot sever service connection without finding that the grant of service connection was clear and unmistakable error. There can be absolutely no debate. It must be shown in the record before the adjudicator. When they decide to sever, they have to point to the evidence and the rules extant at the time of the grant and say the grant was wrong. One big difference between a CUE, clear and unmistakable error, in favor of a veteran versus clear and unmistakable error in favor of the government. If a veteran says you did a clear and unmistakable error in 1970, the burden is on the veteran to demonstrate undebatably that that was wrong based on the evidence and rules extant at the time of that prior decision. Unlike that, if VA is now attempting to sever service connection, VA can rely on more recently developed evidence to substantiate the act of severance. That's one crucial difference between the two. Now, I mentioned earlier that medical evidence is substantially an opinion.
Thank you all for listening. That ends this show. And now I'm going to zoom off.